Okay, so a subspecialist is basically a doctor that's done some additional training to focus in a particular area. People often have in mind their PCP, primary care physician, right, or their family doctor or something along those lines. In reality, medicine is kind of broken down, or medical training, I should say, is broken down into primary care versus specialty care. Medicine is basically broken down into primary care versus specialty care. The primary care people tend to be family medicine, internal medicine, pediatrics, the combined specialty of internal medicine, pediatrics. It's a joint specialty. And then you get some primary care that's delivered by people that work in the emergency room. Those are often emergency medicine trained people. Even though they wouldn't say that's what they do, that's ultimately what they're doing in some of their encounters. And then obstetricians provide some level of primary care, particularly to pregnant women as well. But the bulk of it falls into that family medicine, internal medicine, pediatrics, etc. House. So the people that do the training in that and then begin to focus on sort of the general needs that you may have, all the different types of conditions and problems that may go on, those fall into the category of primary care or so-called generalists, right? And then if you say, for example, I've completed my training in internal medicine, now I want to focus on heart disease as my special area of focus, then you'll go do some additional years of training specifically focusing only on the heart, and you'll come out of that as a cardiologist, right? And so a cardiologist would be a specialist as compared to the internal medicine doctor who would be a generalist, right? What they do is different. If you have a very detailed question about something going on with your heart, the cardiologist is probably the person best equipped to help you with that. If you're just walking in the door, for the first time and you've got chest pain or you're getting a little short of breath when you walk, the generalist may actually be who you want to see for that because that's kind of their area, and there's a bunch of different things, right, that could be causing that problem. The heart is one of them, but there are many, many other problems that could also be going on that might cause that. They can kind of help you get through that. So that's really what a subspecialist is. They have that special area of focus on top of the general medicine. And then whether you can see one only via telemedicine, no, definitely not. I mean, there's plenty of them around and you can see them in person or virtually. It just depends on your needs.